Welcome to a deep dive into the world of topical treatments. We'll be exploring 10 common medications.
Oh, wow, 10.
Yeah, we're going to figure out how they work, what to watch out for, and what you need to know to use them effectively.
Us.
From fighting fungus to tackling acne.
Most people probably have at least one of these in their medicine cabinet,
Right. It's like a whole pharmacy right there on your bathroom shelf.
and most people probably don't even know how they work.
Exactly. So that's what we're going to do today. We'll decode these everyday medications and
Demystify them.
yeah, exactly. Okay, so let's get organized. To make this a little easier to follow, we're going to group these 10 medications by what they fight against.
Makes sense.
We'll start with our antiviral warrior, acyclovir.
Oh, yeah. Good old acyclovir.
You've probably encountered this one before, especially if you've ever had to battle a cold sore.
I think everyone's had a cold sore at some point.
Right. They're the worst.
Yeah, acyclovir is like a tiny wrench.
Hmm.
It jams up the virus's copying machinery.
So it can't replicate
Exactly. It specifically targets those pesky herpes viruses.
the ones that cause those cold sores
Yep. This helps reduce the severity of the outbreaks.
and helps those sores heal faster.
Much faster.
So if you feel that telltale tingle of a cold sore coming on reaching for the acyclovir ASP,
Can make a big difference.
huge difference.
You want to stop it before it really gets going.
Absolutely. But like any medication, it comes with potential side effects.
That's right. And every medication does have some side effects.
Even over-the-counter ones.
Exactly.
What can we expect with acyclovir?
With acyclovir, it's usually pretty well tolerated.
Okay, good.
You might experience some mild side effects like nausea, headaches, or diarrhea.
Okay, nothing too serious?
Usually not. But in rarer cases, especially with intravenous use.
Oh, so not the topical kind.
Right, not the topical kind.
Interesting.
There's a potential for more serious issues with the kidneys or nerves.
Oh, wow.
So staying hydrated and being mindful of any changes in your body is key.
That's good advice for any medication, really.
It is. Always good to pay attention to how your body is reacting.
Right. And while acyclovir is a lifesaver during those outbreaks, it's important to remember that it doesn't actually cure the herpes virus.
Unfortunately not.
It just helps manage it.
Yep. Keeps it under control.
Now let's move on to the bacteria busters.
Okay.
Starting with Bactroban, also known as mupirocin.
I've definitely used that one before.
Me too. It's a go-to for those common skin infections like impetigo.
You'll find it in a lot of first aid kits.
Yeah, it's like a staple.
So how does Bactroban work? It goes after the bacteria themselves.
Instead of messing with the virus's machinery like acyclovir.
Exactly.
Yeah.
It stops them from creating the essential proteins they need to survive.
So it's like cutting off their food supply.
In a way, yeah.
Yeah.
You could think of it as disrupting their construction crew,
Oh, I like that analogy.
preventing them from building their bacterial houses.
So Bactroban is like a demolition crew for bacterial infections.
I love it.
But is it safe for everyone?
Bactroban is generally well tolerated, especially when used topically.
That's good.
You might experience some minor itching or stinging at the application site,
Okay, that's understandable.
but that's usually about it. It's
Mhm.
considered pretty safe overall.
Awesome. Now, switching gears from everyday cuts and scrapes, let's talk about a medication specifically for a much more serious situation. Mafenide acetate.
Mafenide acetate.
Interesting.
This one plays a vital role in burn care.
Oh, wow. Okay, yeah, burn care. That's a whole different ballgame.
It is. With burn wounds, we're not just worried about the initial injury.
You're worried about infection.
We're also battling against potential infections that could make things much worse. That's where mafenide acetate comes in.
So it's preventing infection.
It works by essentially starving the bacteria,
So they can't grow and multiply.
preventing them from growing and multiplying in those incredibly vulnerable burn wounds.
It's like cutting off their resources.
Right. Keeping those wounds clean and free of infection is crucial for healing.
Absolutely crucial. You don't want any complications.
But I imagine applying medication to a burn wound could be, well, painful. Yeah, that's something to think about.
What are the side effects?
You're right, there's often some pain or burning sensation when mafenide acetate is applied,
Understandably.
especially considering the wound is already incredibly sensitive.
Right.
And there's a rare but serious side effect to watch out for called metabolic acidosis.
What is that exactly?
It's a disruption of the body's delicate pH balance,
Oh, wow. Okay, so it's definitely something that needs to be monitored.
carefully monitored,
Huh?
especially with larger burns.
So it's a powerful medication, but clearly one that requires careful use and monitoring by healthcare professionals.
For sure. You don't want to mess around with that one.
Now let's talk about another key player in the burn care world, silver sulfadiazine.
Okay, Silver sulfadiazine.
It's like mafenide acetate's partner in crime, right?
Kind of. But silver sulfadiazine has an interesting twist.
Oh,
It's a double agent. It works against both bacteria and fungi.
wow. A 2-for-1 deal.
Exactly. Burn wounds are susceptible to both types of infections.
So having a medication that can tackle both is a real advantage.
It's very efficient.
How does it do that?
It basically disrupts the outer layers of both bacterial and fungal cells.
Making them weak and vulnerable.
Exactly, like taking down their defenses.
So if this medication is attacking cells, does it affect human cells too?
It can. A common side effect is temporary skin discoloration.
Oh, that's interesting.
It can be a bit startling,
I bet.
but it's important to reassure patients that it's usually not permanent.
That's good to know.
And like most topical medications, there's always a chance of localized irritation or, in rare cases, allergic reactions.
That's a good point, especially for anyone with a sulfa allergy.
Yeah, silver sulfadiazine is definitely off limits for them.
Okay, so we've covered 2 medications for burns. Let's shift gears now and explore the world of antifungal treatments,
Okay, fungus time?
starting with grisofulvin.
I've heard of that one.
You might have heard of it if you've ever struggled with athlete's foot or a stubborn nail fungus.
Ah, yes, those are the worst.
Oh, worse.
Itchy and uncomfortable.
So tell us, how does grisofulvin work?
Grisofulvin disrupts the way fungal cells divide and multiply.
So it's like throwing a wrench into their reproductive cycle.
Exactly, preventing them from spreading.
Makes sense.
This makes it effective for those tougher, deeper fungal infections.
That other medications might not reach as well.
Exactly. It can really get in there.
Okay, so grisofulvin is going after cell division. Does that mean it could affect other cells in the body too?
That's a great question. And it highlights why it's so important to understand how these medications work.
Right. You can't just blindly use something without knowing what it does.
Exactly. Because grisofulvin affects cell division, it can also interfere with how well birth control pills work.
Oh, wow. Okay, that's important information.
It is. So if you're taking grisofulvin, talk to your doctor about alternative forms of contraception.
It's always good to be aware of those interactions.
Always.
And I've also heard grisofulvin can make you extra sensitive to the sun.
That's right.
Is that related to how it works at the cellular level too?
It is. While we don't know the exact mechanism,
It's still a mystery.
a bit of a mystery, but it's thought that the disruption in cell division might make your skin more vulnerable to the sun's rays.
I see.
So if you're using grisofulvin slather on that sunscreen, and be extra cautious in the sun.
Noted. No one wants a sunburn on top of a fungal infection.
Absolutely not.
Now let's talk about another popular antifungal treatment you'll find in many medicine cabinets, miconazole.
Oh yeah, miconazole. That's a good one.
It's like a multi-purpose tool tackling everything from athlete's foot and jock itch to yeast infections.
It's very versatile antifungal.
It is. So how does it work?
Miconazole takes a more direct approach.
Mm.
It attacks the fungal cell membrane.
Oh, so it's not messing with cell division like grisofulvin.
Right. It essentially punches holes in their armor
Wow, that's quite the visual.
and causing them to leak their contents.
Yeah.
Pretty effective way to shut down those fungal invaders.
But punching holes in cell membranes, that sounds like it could have some side effects too.
You're right. Like most topical medications, miconazole can cause some local irritation, itching, or redness at the application site.
Okay, so nothing too serious.
Usually not. Allergic reactions are rare, but they're always a possibility.
Of course. So the key takeaway here is to pay attention to how your skin reacts.
Exactly. And talk to your doctor if you experience any unusual or persistent irritation.
And of course, preventing reinfection is crucial.
Yes, absolutely crucial.
That means practicing good hygiene and keeping the affected area clean and dry.
And that goes for any fungal infection, not just the ones treated with miconazole.
Right, it's just good practice in general.
Exactly. Good hygiene is key.
Now our final stop in the antifungal aisle is tolnaftate.
Oh, tolnaftate. I feel like I've seen that on drugstore shelves forever.
Me too. It's a common ingredient in over-the-counter athletes' foot creams.
Seems like a tried and true treatment.
It does, but how
Yeah.
does it actually work?
Tolnaftate works a bit differently than the other antifungals we've discussed. Instead of directly attacking the fungus, it essentially starves them out.
Oh, wow, so it's like a siege.
Kind of.
Yeah.
It blocks their access to essential nutrients, preventing them from growing and spreading.
So if miconazole is a warrior punching holes in the enemy's armor, tolnaftate is more like a clever strategist cutting off their supplies.
Exactly. A more subtle approach. But it can be just as effective, especially for those milder cases of athlete's foot.
But does it take longer to work?
It can take a bit longer to see results with tolnaftate.
Okay, so patience is key.
It is, but it's generally very well tolerated with side effects being quite rare.
That's always good to hear.
The key is consistency. Applying it regularly as directed is essential for tolnaftate to do its job effectively.
And just like with any fungal infection, preventing reinfection is key. Keep those feet dry, wear breathable shoes, and avoid sharing footwear.
Exactly. All good advice.
Now let's move on to the world of parasites and explore 2 medications that target these tiny but troublesome creatures.
Okay, bring on the parasites.
First up, lindane. You might recognize this one if you've ever battled scabies or lice.
Oh yeah, I've heard of lindane.
So tell us, how does it work?
Lindane is a powerful weapon against scabies and lice.
Okay.
But it comes with some serious considerations.
Ooh, like what?
It works by attacking the nervous system of these parasites,
Wow. Oh,
leading to paralysis and ultimately their death.
that sounds intense. Is it safe for everyone to use?
Well, because lindane is absorbed through the skin and can affect the nervous system.
Oh, I see where this is going.
There's a risk of neurotoxicity, especially if it's used too frequently or for too long.
Yikes.
That's why it's absolutely crucial to use it exactly as directed.
Don't mess around with this one.
And avoid using it on infants, the elderly, or individuals with seizure disorders.
Okay, so it's a medication that requires a lot of caution.
A lot of caution.
And should only be used under the close supervision of a healthcare provider.
Absolutely.
Are there any safer alternatives?
There are. Permethrin is also used to combat scabies and lice.
Okay.
It works in a similar way to lindane.
Targeting the nervous system?
Yep, but it's generally considered safer and better tolerated.
So permethrin is a bit gentler on humans while still being tough on those pesky parasites.
Exactly. You might experience some mild itching or irritation at the application site, but serious side effects are rare.
That's good to know.
However, remember that with any parasitic infestation, it's not just about treating the individual.
It's also about addressing the environment.
Exactly. That means washing bedding and clothing in hot water and treating close contacts to prevent reinfestation.
So it's like a two-pronged attack, treating the person and their surroundings.
Exactly. You got to get rid of all those little critters.
And speaking of attacking, our final medication is in a category of its own, isotretinoin.
Ah, isotretinoin.
This one is reserved for a specific and often very frustrating condition, severe cystic acne.
Yeah, that can be really tough to deal with.
It can. So how does isotretinoin work?
Isotretinoin is a powerful medication.
Yeah.
And it's not something to be taken lightly.
Okay.
It works by shrinking the oil glands in the skin.
Oh, interesting.
And preventing the pores from clogging, which is a major contributor to acne formation.
Okay, so it's getting to the root of the problem.
It is. But it's important to understand that this medication comes with some potentially serious side effects.
I've heard some scary things about isotretinoin. What are the major risks?
Dry skin, lips, and eyes are common.
Okay.
And there's a potential for liver problems.
Oh, wow.
And because of a very serious risk of birth defects, there's a mandatory risk management program called iPledge
I've heard that.
that everyone must participate in if they're taking isotretinoin.
So it's very strictly controlled.
It is. This program involves monthly pregnancy tests for women and mandatory counseling on effective contraception for everyone.
So isotretinoin is not something you just pick up at the drugstore. It requires a serious commitment and close monitoring by a doctor.
Absolutely. It's not something to mess around with.
Are there any other things people should be aware of if they're considering this medication?
Absolutely. Avoid vitamin A supplements while taking isotretinoin,
Oh, why is that?
because this can increase the risk of toxicity.
Okay, that makes sense.
And certain antibiotics like tetracyclines are off limits too,
Why are those off limits?
due to the risk of developing a condition called intracranial hypertension.
What is intracranial hypertension?
It's a buildup of pressure in the skull.
Oh, wow. Okay, so there are a lot of potential interactions.
There are. It's definitely a medication that requires a lot of careful consideration and open communication with your healthcare provider.
Well, we've covered a lot of ground in this first part of our topical treatment deep dive. From antiviral and antibacterial to antifungal and antiparasitic, we've explored how these medications work at the cellular level.
It's fascinating how they can be so targeted,
I know, right?
tackling specific problems while minimizing effects on the rest of the body.
And in part 2 of our deep dive, we'll take a step back and consider some of the broader implications of using topical treatments.
Looking forward to it.
Stay tuned.
I will. Welcome back to our deep dive into topical treatments. We explored some fascinating stuff last time about how these medications work on a microscopic level.
Right. It's incredible how they can target everything from viruses and bacteria to fungi and parasites.
It really is like having a microscopic toolkit for your skin.
Oh,
But now I'm thinking about the bigger picture. How do these topical treatments fit into our overall approach to managing these conditions?
yeah, that's a good question. It's one thing to know how they work at a cellular level, but what about their role in the bigger picture of treatment?
One of the biggest advantages of topical treatments is their targeted action.
So go straight to the source.
Right. Unlike oral medications, which travel throughout your whole system, topical medications are applied directly to the affected area.
So that minimizes the risk of side effects elsewhere in the body.
Exactly. It's like delivering a package directly to the right address instead of sending it on a roundabout journey through the entire postal system.
I love that analogy. So if I'm using a topical antifungal cream for athlete's foot, I'm less likely to experience those side effects that might come with an oral antifungal medication.
Exactly. Like nausea or liver problems.
Right, makes sense.
And this targeted approach can be really important for certain people.
Like those who are more sensitive to medications.
Exactly. Infants, the elderly, or individuals with compromised immune systems.
So topical treatments can be a safer option for them.
Often they are. It allows us to treat the problem directly while minimizing the potential for unwanted effects on the rest of the body.
It's like finding that sweet spot between effectiveness and safety.
Exactly.
Yeah.
But targeted action is only one part of using these treatments effectively. What about patient education?
Oh yeah, that's crucial. You can't just give someone a medication and expect them to know how to use it properly.
Right. It's like handing someone a complex piece of machinery without explaining how to use it.
You're going to have problems.
People need to understand how to apply the medication correctly, how often to use it, and what side effects to watch out for.
And that's where those patient information leaflets come in.
Exactly. Those leaflets that so many people just toss aside.
Okay, I'll admit I'm guilty of that sometimes too.
But they contain really important information about dosage, potential side effects, and specific precautions.
Things that could make a big difference in how well the treatment works and how safe it is.
Exactly. And if anything is unclear, don't hesitate to ask your doctor or pharmacist for clarification.
It's always better to be safe than sorry. Now, another thing that's come up a lot in our discussion is the importance of hygiene,
Oh yeah, hygiene is so important.
especially with those pesky infections.
Absolutely. Whether you're dealing with a fungal infection, a bacterial infection, or a parasitic infestation, keeping the affected area clean and dry is key.
So more than just washing with soap and water.
Often, yes. It might involve using medicated cleansers, thoroughly drying the area after showering, and avoiding sharing personal items like towels or combs.
It's like we're detectives, not just treating the crime, but looking for clues to prevent it from happening again.
Exactly. We're breaking the cycle of infection.
And that brings up another interesting point, the possibility of avoiding systemic medication.
Oh yes, that's a huge benefit of topical treatments.
In many cases, they can be a great alternative to oral or injectable medications.
Especially if we're trying to minimize side effects or drug interactions.
Right. By keeping the medication localized, we can reduce the risk of those systemic effects.
Exactly. It's like a more targeted approach with potentially fewer downsides.
It's like finding the right tool for the job.
Exactly. And that's where a healthcare provider can be so helpful.
They can assess the situation and figure out the best approach.
Exactly. They can weigh the risks and benefits of different options and develop a treatment plan that's tailored to the individual.
It's like a partnership working together to find the best strategy.
Exactly.
Yeah.
Now let's talk about how topical treatments fit into the overall strategy for managing these conditions.
Right. Are they always a standalone solution? Or do they sometimes work in conjunction with other treatments?
It really depends on the specific condition. Sometimes they're used alone, and sometimes they're combined with other treatments.
Like a team effort.
Exactly. For example, someone with severe acne might use a topical retinoid along with an oral antibiotic to tackle the problem from multiple angles.
A multi-pronged attack.
And in other cases, topical treatments might be used as a preventative measure.
To reduce the risk of infection.
Exactly. Someone who's prone to athlete's foot might use an antifungal powder regularly to keep their feet dry and prevent the fungus from taking hold.
So the role of topical treatments can vary depending on the situation.
Absolutely. And that's why open communication with your healthcare provider is so important. They can guide you through the complexities of treatment options and help you make informed decisions.
They're like our trusted advisors in the world of healthcare.
Exactly. Now, as we wrap up this part of our deep dive, I want to leave our listeners with something to think about. We've explored the science behind these topical treatments, but what about the human element? What about the impact that skin conditions can have on people's lives?
You're right. Skin conditions can affect so much more than just our physical health. They can impact our self-esteem, our social interactions, our overall well-being.
Imagine the relief that a simple topical treatment can bring to someone struggling with a chronic skin condition. It's not just about clearing up the physical symptoms, it's about restoring confidence and improving quality of life.
It's like a ripple effect, like extending beyond the skin and touching every aspect of a person's life.
And sometimes it's not just about the individual, it's about the broader societal impact of these conditions.
Like the stigma that can be associated with certain skin conditions.
Exactly. And the social isolation that can result.
And not to mention the economic burden of treatment.
It's a multifaceted issue that affects individuals, families, and communities.
It's a reminder that healthcare is about so much more than just treating symptoms.
It's about improving lives and empowering people to live their best lives possible.
And speaking of living our best lives, we've got one more part of our deep dive to explore. Stay tuned as we delve into some final thoughts and considerations regarding these everyday medications. Welcome back to the final part of our deep dive into topical treatments.
It's been quite a journey.
It has. We've covered a lot of ground, from exploring how these medications work to considering their impact on people's lives.
And how they fit into the big picture of healthcare?
Exactly. But as we wrap up, I think it's important to acknowledge that topical treatments, like any medical intervention, aren't without their limitations.
You're right. They're not a magic bullet for every skin problem.
So when might a topical treatment not be the ideal solution?
Well, one limitation is that they might not be suitable for all types of skin conditions.
Like if the condition is too deep or widespread?
Exactly. A topical medication might not be able to reach it effectively.
So you'd need a more systemic approach.
Right, something that can travel throughout the body.
Like an oral medication.
Exactly. And another limitation is patient compliance.
Oh yeah, people forgetting to apply the medication regularly.
It happens all the time. Topical medications often require consistent application to work properly.
And life gets busy. It's
Yeah.
easy to forget.
It is. And then there are the practical aspects.
Like some of them being messy or inconvenient to apply.
Exactly. Leaving greasy residues or staining clothes.
Ugh, those stains can be a nightmare.
They can. And we can't forget about skin irritation.
Right, some people might be sensitive to certain ingredients.
It's always a good idea to do a patch test before using a new topical medication.
That's a great tip. Apply a small amount to a discrete area and see how your skin reacts.
Exactly. Better safe than sorry.
So despite these limitations, topical treatments are still a valuable tool for dermatologists.
Oh, absolutely. They offer a targeted and often effective way to address many skin conditions.
And they can make a huge difference in people's lives.
They really can. But it's important to remember that no treatment is perfect.
Right, there are always trade-offs to consider.
Exactly. But by understanding the benefits and limitations of topical treatments, we can make informed decisions about our skincare.
And work with our healthcare providers to find the best solutions.
It's all about finding that balance between effectiveness, safety, and practicality.
And empowering people to take control of their health.
As we wrap up this deep dive, I want to leave our listeners with one final thought.
Okay, I'm listening.
We've talked a lot about the science behind these treatments. But let's not forget about the human side of things.
The impact these conditions can have on people's lives.
Exactly. Their self-esteem, their social interactions, their overall well-being.
It's easy to get caught up in the technical details, but ultimately, it's about people.
Imagine the relief a simple topical treatment can bring to someone struggling with a chronic skin condition. It's not just about clearing up the symptoms. It's about restoring their confidence.
Helping them feel comfortable in their own skin.
Exactly. And that's something worth striving for both as individuals and as a society.
Well said. I hope our listeners feel empowered to take charge of their skincare journeys with this newfound knowledge.
Remember, knowledge is power. The more you understand about these treatments, the better equipped you'll be to make informed decisions.
So keep learning, keep exploring, and keep taking care of your skin. And most importantly, stay curious.
Absolutely. Thanks for joining us on this deep dive.